The state has also recorded a second death. Away from that now, health workers are at high risk of exposure to the coronavirus in Nigeria. At least 40 of them have tested positive and a few have died. This highlights the need for them to be properly insured so their loved ones can benefit from the claims in the event of death or life-threatening outcomes. During President Muhammadu Buhari's national broadcast on Monday, he said 5,000 free insurance covers have been procured for frontline health workers in the country. He also commended the insurance sector for making this happen quickly. Acting Commissioner for Insurance, Olorundare Sunday Thomas, now joins us from our Abuja studio to speak more on insurance for health workers amid the spread of the coronavirus. Thank you for joining us on TVC News at 7. Well, tell us about the free life insurance cover that is being offered to the frontline health workers in Nigeria.
Yeah, thank you very much. Thanks for welcoming me. It's not actually free, it's paid for by the insurance sector, the insurance industry. And for us, we believe that there is a need for every citizen to support the government, especially at this time. So much resources has been poured into the dealing with COVID-19. And of course, the first port of call for us in the insurance industry is to look at our business and see areas in which we can support the government. And therefore, we came together and said that we look at the frontline workers, doctors, nurses, laboratory workers, other workers that are involved in COVID-19. And we provided some benefits, which is going to be a top-up to the one already provided under the Pension Reform Act 2014. It is assumed that majority of those that will be working will first of all have the baseline group life cover. Of course, I'm sure that the federal government has, and some of the state governments. The cover, the 5,000 people, is to cover all the states of the federation.
Well, this initiative, this initiative is quite commendable, and well, kudos to your team. Well, as at when the free insurance package was made public, the sum assured was 17 billion naira. Has that figure increased now?
Yeah, it's just 11 billion, not 17. And the fact is that these are the liabilities that the insurance industry has assumed on their own, and you are looking at a worst-case scenario. Of course, as the issues arise, nobody prays for a total fatality, but where we have we have the backing of our reinsurer, the reinsurer has given us the assurance that when it gets so bad, they always will be there for us.
All right. Now, a total of 5,000 workers are to benefit from this cover. Give us the breakdown of what accrues to each health worker depending on what exactly they do.
Well, essentially, that is being worked out by the office of the chairman of the Presidential Task Force. They will work it out as it affects each of the states. I would like to skip that for now.
Okay, and the cover has a 1-year lifespan. Is there any specific reason for this duration?
Of course, we don't expect that the COVID-19 is going to last even up to 1 year, because looking at the effort that the government has put into this, we want to put it behind us as quickly as possible. Yes, of course, it's a new virus. They call it a novel. But at the same time, we believe that in this Nigerian mentality, the Nigerian way of dealing with matters like this, we don't need to go through the bend like other countries. I'm sure once we get to the peak and we begin to descend, we're going to descend very fast into a zero level. I believe that it's not even going to last up to 1 year. So that's why it's this assumption that has limited the period of cover to 12 months.
All right, and the insurance cover is for health workers who are employed in the fight against COVID-19. But I'm curious, what about those in private practice who have become exposed while attending to patients who held back information?
Well, for those, you cannot begin to provide for those you don't know. Essentially, we know that these ones are committed to government efforts, and therefore, part of our responsibility as an industry is to support the government. For those that are unknown, that are working with the private sector, probably by the time they come around, a different arrangements can be made for them. But the one we are dealing with right now are the ones that we are sure of we can identify those they are working for. And that's what has prepared us to make that necessary provision.
All right, once again, appreciate it for what you're doing. Acting Commissioner for Insurance, Olorundare Thomas. Thank you for talking to us on TVC News at 7.